Nurse practitioners are vital to healthcare in the United States. What sets nurse practitioners apart from other healthcare providers is their unique emphasis on the health and well being of the whole person. They add their special touch to many different arenas of healthcare as certified nurse midwives, acute care nurse practitioners, clinical nurse specialists, primary care nurse practitioners, and certified registered nurse anesthetists. Today, our group is honoring the unique role of the certified registered nurse anesthetist. To understand this role, we are going to do a recap of what it took to get where they are today. Nurses have functioned in roles as anesthetists long before there was a title for them. During the American Civil War, lay women had volunteered to help with the war efforts. Some of them assisted in surgeries by providing anesthesia with chloroform. The first nurse anesthesia education was offered in 1909. These early nurse anesthetists proved their value in many venues, eventually receiving pushback from some physicians, stating these nurses were practicing medicine. A landmark decision affecting all nurse practitioners occurred in 1917 and had come from the practice of nurse anesthetics, deeming it legal but subordinate and required oversight by physicians. Reimbursement for nurse practitioners has not come easy, as it was not until 1989 when CRNAs were the first nurse specialists to receive direct reimbursement for their service. The CRNA role is specific to surgery. Their role extends from the pre anesthetic preparation and evaluation to induction, maintenance, and emergence from anesthesia to post anesthesia care, and finishes with peri anesthetic and clinical support functions. This makes their role more rigid than other advanced practice providers. The healthcare team that they will be working with includes physicians, surgeons, dentists, podiatrists, anesthesiologists, and nurses. Their scope of practice includes 5 domains listed as preoperative and pre-procedural, intraoperative and intraprocedural, postoperative and post-procedural, pain management, and then other services. All of these are dictated by the American Association of Nurse Anesthesiology. As of January 1, 2022, any student entering a nurse anesthesia program must be enrolled in a doctoral program. Master's degrees are no longer acceptable. Students who complete nurse anesthesia programs must pass the certification exam from the National Board of Certification and Recertification for Nurse Anesthetists. And their recertification includes 100 hours of continuing education every 4 years. According to the American Association of Nurse Anesthesiology, the CRNA standards apply where anesthesia is provided, including but not limited to the operating room, non-operating room anesthetizing areas, ambulatory surgical centers, and office-based practices. The CRNA standards apply where anesthesia is provided, including but not limited to obstetrical anesthesia, diagnostic, therapeutic, and pain management. As a CRNA, you will be expected to provide patient centered care, and that includes respecting patient autonomy, dignity, and privacy, supporting patient needs and safety, obtaining informed consent for anesthesia care, and communicating effectively with patients and their family or caregivers. Comprehensive patient assessment includes performing a thorough pre anesthesia evaluation, conducting an anesthesia focused physical assessment, formulating a patient-specific anesthesia care plan. Documentation and communication includes maintaining accurate, timely, and complete anesthesia care records, communicating effectively with the healthcare team, and transferring care appropriately, ensuring continuity. Equipment proficiency includes conducting appropriate equipment checks, verifying equipment function before each anesthetic, operating equipment safely to minimize risks. And then there's patient management and monitoring that includes implementing and modifying anesthesia care plans as needed, continuously assessing patient response to anesthesia, monitoring oxygenation, ventilation, cardiovascular status, and temperature. Next is safety and infection control that includes adherence to infection prevention and control policies, participation in a culture of safety, and collaboration with interdisciplinary teams. The next is professional development and well-being, and that includes participating in ongoing quality improvement processes, maintaining physical and mental wellness, and engaging in lifelong learning and skill development. According to the Pennsylvania Association of Nurse Anesthetists, these are the current competencies for CRNA practice. The registered nurse has successfully completed a program of school for nurse anesthetists accredited by the Council on Accreditation of Education Programs of Nurse Anesthesia of the American Association of Nurse Anesthetists, and the registered nurse is certified as a registered nurse anesthetist by the Council on Certification. After completion of the program and certification, the CRNA must possess the following competencies. Graduates will acquire knowledge, skills, and competencies in patient safety, peri-anesthetic management, critical thinking, communication, and the competencies needed to fulfill their professional responsibility. These competencies must include central and arterial line insertion, including, when appropriate, the use of ultrasound guidance, obtaining, interpreting, and intervening on arterial blood gases, intubation and advanced airway management, ventilator management and troubleshooting, dosing and administration of sedation for mechanically ventilated patients, management of paralytic drips, as well as maintaining and monitoring invasive lines, vasopressor selection and management, intravenous fluid and blood administration, ventilator weaning, extubation, and post-extubation evaluation and care. The issues facing CRNAs today are burnout, as this is a very stressful position. You are holding that patient's life in your hands. There's also a staffing shortage, and we'll talk more about that in a little bit. And we're also going to talk about independent practice. That's another issue facing them today. Many states have gone to that, and we will be talking about that also. The future of CRNAs is that there is an increasing demand for the CRNAs, but an even greater shortage. There will be a change in the landscape of doctoral prepared versus master's prepared CRNAs due to the change in the enrollment criteria. A huge change that began in 2001 is that state governors were allowed opt-out policies which remove physician oversight requirements for Medicare billing purposes. And so far, 25 states have chosen opt-out policies. Thank you for listening to our presentation. Just in our conclusion, we'd like to honor the CRNAs. They have a huge amount of education and responsibility that goes along with this position. And we'd just like to thank you for listening to our presentation.